Hi, my name is Linda. I am not a medical professional, and the information in this video is for your information only. If you have any worries about your condition, you should consult with your healthcare professional. In this video, I shall explore which is more painful, the factors influencing the pain, what can be done for relief, and much more. When you develop tendinitis or bursitis, the common conditions are joint pain and discomfort, particularly if you have arthritis. While they share similarities, they have distinct symptoms, severity levels, treatment, and much more. But first, I shall explore the understanding of tendinitis and bursitis. Tendinitis is an inflammation of the tendons, which are thick, fibrous tissue that connect muscle to bone. It often results from repetitive movements, or strain on a specific joint. These can include Achilles tendinitis, rotator cuff tendinitis, and tennis elbow. Bursitis is also an inflammation, but this is from the bursa, a small, fluid-filled sac that cushions between bone, muscle, or tendons. Bursae reduce friction and allow smooth, even movements, especially in your larger joints like the shoulders, hips, elbows, and knees. The causes and risk factors of both diseases include repetitive movements, or overuse, and if you have an injury or trauma. When you develop arthritis, you are at a higher risk, as you are putting more strain on your joints. Age is another risk factor. Both tendons and bursae naturally lose elasticity, and become more prone to inflammation when you age. The power of the pain from either condition depends on several factors, including the location, severity, and pain tolerance. However, here is how the pain can differ between the two. Tendinitis can cause sharp pain that is localized during movement. The pain strengthens with use, affecting the tendon and making everyday tasks challenging. The pain is often pinpointed to an affected tendon area, but it can also radiate from the joint, depending on the joint involved. The pain of tendinitis can also become chronic if left untreated, leading to persistent discomfort and stiffness, whereas bursitis pain is a dull ache rather than a sharp pain. The pain can increase when pressure is applied or after prolonged inactivity, for example, sitting or lying down. You could also have swelling and redness that can result in a noticeable swelling, which may be painful to the touch. Flare-ups are also a condition of bursitis that can become sudden, especially after having overuse of the joint, and can cause a significant increase in pain and immobility. You can do home treatments to help reduce the pain and inflammation. For tendinitis, you could rest the area to reduce the strain on the tendon and apply an ice pack to reduce the swelling. Physio is also good as it helps to target and strengthen the muscles around the tendon. Another is having medication like ibuprofen that can relieve pain and inflammation. Lastly, if you need to reduce movement to allow the area to heal, you could get a brace or splint. When you develop bursitis, it is the same as treating tendinitis. It would help if you could rest the joint area with ice to reduce inflammation, take medication for the pain and swelling, or do physiotherapy, a gentle exercise that relieves pressure and helps mobility. But if your bursitis is severe, you may need steroid injections or corticosteroid injections to reduce inflammation. In some cases, fluid may need to be drained from the swollen bursa. To manage your pains and prevent recurrence, you should avoid repetitive motions that strain your tendons or put pressure on joints. Building strength around the affected joints can reduce the risk of both conditions. Stretching before physical activity can prevent overuse injuries. Wear supportive footwear. If you are a lady, you must get low heels, not high heels, as you are putting more strain on your foot. It is best if you buy shoes with good support that reduces strain on tendons and bursae in the lower body. Tendinitis and bursitis conditions can impact daily life. I will start by explaining the different parts of the body that tendinitis can attack. Number 1, Achilles tendinitis is located at the back of the ankle. The symptoms are sharp pain and stiffness, especially after activity, or in the morning. This is caused by repetitive stress from running, jumping, or sports that involve sudden starts and stops. Number 2 is rotator cuff tendinitis, which is located in the shoulder. The symptoms are pain and difficulty lifting the arm. The pain may be more intense at night, or while lying on the affected shoulder. The cause could be an athlete, such as putting your arms over your head, often in swimming, tennis, or occupations requiring overhead work. Number 3 is tennis elbow, or lateral epicondylitis, located on the outer part of the elbow where the tendons are. The symptoms can be pain and tenderness on the outer side of the elbow that involves gripping, lifting, or twisting. The causes are repetitive wrist and arm movements, such as those of a tennis player, carpenter, painter, or if you are an office worker, that type frequently. Number 4 is patellar tendinitis, or jumper's knee, located in the tendon connected to the kneecap, patella, and shin bone. The symptoms are pain and tenderness on the front of the knee, particularly when you bend, squat, or go upstairs. Causes are jumping or running repetitively, especially if you are a sports person, such as basketball or volleyball. Number 5 is wrist tendinitis, which affects the tendon around the wrist. Symptoms can include pain, swelling, and stiffness around the wrist, especially with activities involving wrist movement. The causes could be typing, writing, or using tools. On the other hand, bursitis conditions can include the following. Number 1. Hip bursitis, which is located outside the hip. The symptoms are pain on the outer hip that worsens when lying on the affected side or prolonged sitting. The cause is prolonged pressure on the hip, repetitive movements, or a condition like arthritis. Number 2. Elbow bursitis is located at the tip of the elbow and can cause swelling, tenderness, and pain at the back of the elbow with redness. The causes are leaning on a hard surface, injury, or infection. Number 3. Knee bursitis occurs in front of the kneecap or patella. The symptoms are swelling, tenderness, and warmth over the kneecap. The pain can increase with kneeling or bending the knee, such as a gardener or plumber, direct trauma, or infections. Number 4. Shoulder bursitis, is located under the acromion, part of the shoulder blade. The symptoms are pain and stiffness in the shoulder, particularly when putting your arms over your head or lying on the affected side. It can cause repetitive overhead activities, direct trauma, or shoulder injuries. Number 5 is ischial bursitis, which is located in your pelvic bones. Symptoms include sitting pain, particularly on hard surfaces. Discomfort may radiate to the lower back or thighs. The causes are prolonged sitting, especially on hard surfaces, or injury to the area. Bending forward or walking can also be uncomfortable, affecting daily comfort and posture. When you get chronic pain from any arthritis or disease, you can manage it by resting and avoid trigger movements, especially if you have tendinitis. It will help reduce strain on the tendon and prevent painful flare-ups. You should do strengthening exercises that include physical therapy exercises, such as strengthening surrounding muscles and reducing the risk of chronic pain. If you have sharp pain and inflammation, the best therapy is ice therapy. You apply ice to the affected area, which reduces the symptoms. But always put a towel around the pack. Do not put it straight onto the skin. Pain relief could also be prescribed for bursitis also. It would help if you avoided pressure on the affected bursa. Using cushions or padding can reduce pain. You could also be given anti-inflammatory medication to help manage persistent aches and swelling. Draining excess fluid or corticosteroids may help to relieve pain in severe cases. So, which is more painful? This question varies from person to person, but tendinitis tends to be described as more intense and acute. It can also feel more severe during movement. Bursitis involves a continued dull ache that can feel persistent when the inflammation is high. In conclusion, while tendinitis and bursitis are distinct conditions affecting tendons and bursae, they share common triggers. They can cause significant pain and mobility issues, particularly for those with arthritis or an active lifestyle. Tendinitis often presents with sharp, movement-related pain, whereas bursitis tends to cause a dull, persistent ache worsened by pressure. Understanding these differences is key to effectively managing each condition through rest, physical therapy, anti-inflammatory treatments, and lifestyle modifications. Effective pain management for both conditions involves a tailored approach. Reducing strain on the tendon and performing strengthening exercises can benefit tendinitis. At the same time, bursitis often responds well to reducing pressure, using cushions or padding, and in some cases, medical interventions like aspiration or steroid injections. Preventive measures, such as warming up before activities, practicing proper form, and incorporating ergonomic adjustments, can reduce the risk of recurrence. With the right strategies, individuals can manage their symptoms, regain mobility, and improve their quality of life, minimizing the impact of these conditions on daily activities and physical pursuits. Final thoughts. Both tendinitis and bursitis can cause significant discomfort, but their pain outlines differ. Tendinitis often brings sharper, more movement-focused pain, while bursitis presents a dull, constant ache that intensifies under pressure. Managing either condition effectively involves rest, targeted therapies, and lifestyle adjustments to prevent future flare-ups. For those with arthritis, consulting a healthcare provider can help tailor treatments to address underlying arthritis and these painful conditions, ensuring comprehensive relief and improved joint health. Thanks for listening to my video. I am not a medical professional, and the information in this video is for information only. If you have any worries about your condition, you should consult with your healthcare professional. If you found this video helpful, or have any questions, please leave a comment in the comments box, and click the subscribe button to follow my channel, and press the bell. I hope this video has helped, and good luck.